Hello, my name is Kim Baily and I'm an instructor at an ADM program in Southern California in a community college. In my previous role as Director of Nursing, I was responsible for establishing a simulation program in the community college setting. This including finding funding, finding resources, training faculty. I've also been responsible for developing the design of a brand new 4-room simulation lab in a building that is currently under construction. 4 years ago, our program was like many others in the area. We kept our sim mannequins tucked away in a cupboard so that the students wouldn't break them. We were really not sure how to use them. We had no idea about how to incorporate simulation into our teaching program. I have fond memories of struggling to get our sim mannequin out of a narrow closet and into the lab where it could be used. It was a frustrating experience and faculty were very reluctant to get involved. I had to find a dedicated space, we had to train instructors, we had to find a technician. How would we advertise for a technician? How would we train them? How would we keep them? And how would we fund payment for them? I really had no idea what I was getting myself into, and there were very little resources available at the time. And although there's something to be said for charging around like a bull in the china shop, I made some costly errors that had I had more information, I would have been able to prevent those errors and save myself some money. One example I can think of is funding that went into the general fund at the end of the fiscal year, which I was going to use to purchase a new mannequin, and I lost that money because I didn't spend it in time. You could be sure that didn't happen again in the second year. At the same time the original lab was under development, very few sim programs were in existence in our area, and so it was very difficult to get resources and information. There were so many different things to consider. How would we encourage faculty to become involved in simulation? How would we motivate the change? How would we develop their learning? How would we schedule simulation within the program? How would we conduct student orientation? Would we use simulation just for teaching, or would we use it for testing? What about confidentiality issues? How would we assess whether our program was successful? How could we motivate change within the student community and the faculty themselves? Would we need to pay for outside help? And if we did, where would the money come from? How would we maintain our equipment? Which equipment should we pick? Should we have an open house? How would we get the college administration to buy into the program? There were so many questions. And then of course there's always the issue of money. I knew very little about funding from the estate, accounting and reporting, and how was I going to get this money to fund it? So I had to learn quickly about state funding, the accounts, how you get funding to move from one account to the other, what money I could use to buy the equipment itself, what money I had to use for supplies. And then of course there was the opportunity to perhaps invite folk from our local community who could come in and perhaps rent our space when we weren't using it, and therefore we would be able to use that money to support our sim lab to buy equipment and fund supplies. And how would we develop those contracts? Where would we find those people that were interested? How would we advertise and so forth? And so at that time there were very few resources available. The HealthySimAdmin conference that's coming up will bring together administrators from all over the world to share best practices, their ideas, so that we can help each other manage these multiple issues. I know that our program has been successful because the students really love it. They say it gives them a great opportunity to learn in a safe environment, that if they mess up, they're not hurting the patient. We know that the college administration loves it. They frequently use photographs and clips from the sim lab in their local brochures and publications that they produce. They're touting the sim lab all the time, so the college is very proud of it and have supported us. And we have been able to go outside into the community and bring other programs into the sim lab, and they've paid us for the use of the sim lab, and that's been invaluable in funding our sim lab and maintaining really up-to-date equipment. I look forward to either meeting you in person in Las Vegas or perhaps over the web at the HealthySimAdmin conference in October. I know that we will all get together and share each other's experiences and learn from each other.